Mr. Jones, how are you feeling today?
Well, I'm not feeling much better, I'm afraid. But we are going to keep trying to make me better, right?
Of course. But today I want to talk to you about your values and what might be important for you if you happen to get worse.
What do you mean by worse?
Well, if your breathing gets worse, or if you have a sudden emergency with your heart, we may need to move you to the intensive care unit. That would mean that you would likely need extra medicines or machines to treat you.
But then I'd get better, right?
Well, we can never really say for sure how people will turn out. Most people get better and go home. Others, they get better, but they're much weaker than when they came to the hospital, or they have trouble thinking as clearly. And some people do die, even with ICU treatments.
But it's worth giving it a shot, right?
Well, that's where your values and preferences would come into play. While the benefits of the ICU are that there are many treatments to help with your illness and increase your chances of survival, you may be in more pain or discomfort because of the medications and all the machines. You may also not be able to speak with your family because you might have a breathing tube. And if you did end up dying, it wouldn't be very natural and might be very stressful for your family.
Well, that's an awful lot to think about.
Yes, yes, it is. That's why we like to have these conversations so that you can reflect on what's important to you. And then it's really important that you tell your healthcare team and your family about what is important so that if you do become more ill and can't speak for yourself, we can make some medical decisions that reflect your wishes.
Well, at the moment, I do have a goal, and the goal is to get better so that I can go to my granddaughter's wedding in the summertime, and that is really important.
Okay. So for you, prolonging your life is what's most important right now. I will recommend that, if necessary, we move you to the ICU and use machines if you do get worse.
And what if I change my mind later on?
Well, you can always change your mind. You can. Just make sure you keep talking and sharing your wishes with your doctors and your family so they know how you're feeling. We all want you to get the medical care that's right for you.